don't know if I can keep coming up and down to introduce people to speak. So I probably need a mic.
Set the mic down there and you can just do it from there.
That would be better. That would be better.
I'll just be in the back and when you're ready to come off.
Either that, unless you have a chair up here for me to sit at.
Which I can.
We can take one of these.
You want to?
Banquet chair.
That's fine. Why don't we do that? And then we'll go up and down. Okay? Am I on? Live? No, I will be over here. Okay? I can't get down there. It's not going to be easy for me to get down. Okay, you'll have to come up to me. Okay? Thank you. Hello, everyone. Welcome to our next session, Transitioning to Adults, My Life is More Than My Diagnosis. It's just an honor to first be able to be the moderator of this session. Our first speaker is Stacy Hewson. Stacy's with the Hospital for Sick Children in Toronto. Stacy Hewson is a genetic counselor at the Hospital for Sick Children, working in the Division of Clinical and Metabolic Genetics for the last 17 years. She received her Master in Science degree in Genetic Counseling from McGill University in 1998 and a Master of Science degree in Molecular Biology from McGill in 1996. She obtained certification by the Canadian Association of Genetic Counselors in 1998, by the American Board of Genetic Counseling in 1999. She's actively involved in the University of Toronto MSc program in genetic counseling in both clinical supervisory and lecturer capacity. She has a special interest in patient advocacy for rare diseases, aren't we lucky with that, and has been facilitating a parent peer support group for the last 5 years. She developed a transition framework and leads the transitioning process of youth using resources developed by the Good to Go program within the metabolic program at Sick Kids. She has been invited to speak to many organizations, including the Canadian Association of Genetic Counselors, CACG, and the National Gaucher Foundation of Canada, and the Canadian MPS Society, and we are welcome to bring Stacy Hewson to the stage. Thank you.
Thank you for that introduction, and thanks for the honor of being able to present to you today. And thanks for hanging out for the last session, because I'm sure it's not easy after a long day. So hopefully we can make it interesting. And I'm sure the speakers after me are very interesting. So I look forward to that too. So my title is actually really about transition. I think my title in the program seems a little more lofty, but I will try to certainly hit on the program that we do at Sick Kids that we've utilized with a transition program that developed a lot of tools that I will talk about that are valuable, I think, for parents, families, youth, as well as adults. And so hopefully we'll kind of hit on all those points throughout my talk. So here's a bit of an overview. I wanted to talk just a bit about, in general, the transitions that occur around adolescence, and then talk specifically about healthcare-related transition and the tools that we've been using at our institution, and a few other tools I will throw in as resources that can help families and youth prepare for that transition into adulthood and adult healthcare. I also think some of those tools can also be used for adults in advocating for their own healthcare, depending on where you are in that route. I want to talk a tiny bit maybe about things I found about taking control as an adult. I certainly, although I'm an adult, I don't know taking control with related to rare disease or MPS, and so the speakers following me are certainly the role models for the audience in that piece. And I will put in a little bit of resources, and if we have time for questions, we can go there too. So types of transitions, if we think about adolescence, it's certainly a transitional stage of both physical and psychological development for teens. And when you think about the transitions that occur kind of starting at adolescence and into adulthood, there are transitions within many different systems. So certainly in healthcare, I mean, I work at a pediatric institution, so all of our teens are eventually transferred into adult healthcare. That may or may not be the case dependent on where you are and where you're followed. But there still are a lot of transitions, even within healthcare, even if you're staying with the same core team, in the idea that you, as a youth turning to an adult, you should be taking more control of self-advocacy and control of managing your own healthcare. But certainly there are transitions in other areas as well, including education, legal status, insurance issues, which again, the US people will have more understanding about that than I do, but certainly insurance changes even in Canada when you're a child into adulthood, as well as navigating the area of a youth becoming more autonomous and more the time for self-management, sort of balancing that with parents and family and taking on control of some of that for their own health care. I wanted to talk a bit about emerging adulthood. So this was a phrase coined by Dr. Arnett, a psychologist, talking a bit about the sort of stage between adolescence and adulthood, where the age being about 18 to 25, where youth feel like they're no longer teens, but they're not quite adults, kind of in that sort of framework. And I think it's there are 5 characteristics that Dr. Arnett had suggested include in this time of your life, that include identity exploration, deciding kind of what you want, both out of work, school, love, career, things like that, but also as an age of instability, an age of where you're very focused on yourself, feeling in between, also an age of possibilities. And I think that this is a critical stage in where healthcare professionals need to sort of help guide or aid youth while they're making those decisions, because all of making good decisions and getting successful in all of those areas are very important in order to be successful adults. So the definition of healthcare transition is the purposeful and planned movement of adolescents or young adults from a child-oriented health care system into an adult health-oriented healthcare system. And I guess the key, which is bolded, is sort of purposeful and also planned. So it's not just, you're turning 18, okay, tomorrow you're going to go to adult and that's it. It's certainly suggested that it start either at diagnosis or at least by age 12 to make plans that would ensure all of the parts of a successful transition are instituted prior to the transfer. So this, I'm not sure it projects very well, but this is the model that the Sick Kids program is based on, and many other transition programs are based on, called a shared management model, where both the parents and the youth or the child have specific roles to play. And it uses a business analogy, which seems to make sense to people or resonate with people, in the idea of when a child is very young, the parent provides all the care and is kind of like the CEO. And there's a stepwise method where the child assumes some of those responsibilities. So I don't know if I have a pointer. Maybe I do. This, I think. So here the child's receiving all the care, the child in a small stepwise developmentally appropriate way, the child starts doing some of their own self-care, then the child may become the manager of the care, and then the child then eventually, hopefully as a youth, becomes the supervisor, with the parent acting as a consultant. And so the idea being that the child stepwise assumes more responsibility and the parent stays actively involved but reduces their seniority, I guess, if you will, until the child then, or young person becomes completely the CEO. So this model takes into account that there is an active play between parents and youth, and that it can happen for all youth, independent of where they can end up along this trajectory, but at least as much as developmentally appropriate, can take on some of that responsibility. So there are many position statements regarding transition to healthcare, to adult healthcare for youth with special healthcare needs or with chronic conditions. I kind of just merged a couple of the points that seemed the most relevant for me, both from the Canadian Pediatric Society as well as the American Academy of Pediatrics. Again, it being an ongoing process so that it shouldn't just happen all in one shot. Your healthcare team should be annually or semi-annually talking about this as a process of how a child can assume more responsibility, learn more about their own healthcare management, and so that it's not all of a sudden a sort of, you got to do everything at once. And that the team should provide appropriate resources and educational materials to help families do that. That again, that it's youth focused, so focused on the youth and encouraging them to become play a more active role in their healthcare. That support should also be provided for family members, because certainly in my experience, the parents can be very attached to the healthcare team, and it can be quite traumatizing for the parents as they get close to transition. So I think that those are things to be taken into account as well. Again, developmentally appropriate. And that it should include information not only about the condition and the specifics of what's happening with that youth's health, but also other parts of health, like sexual health, as well as other things that are important outside of healthcare, but for your life, like education, career, and independent living needs. Now, these might not always come up at your sort of primary healthcare appointment, but certainly something to kind of keep in mind if there are other members of the team that could help with some of those. So for instance, we have a social worker that can help certainly thinking about adult planning and independent living, or even with a nurse talking about career choices or educational type scenarios. And then I think it's also important for our healthcare team to talk about and teach the youth how to advocate for themselves, both within a healthcare setting, but also potentially outside of that. And then I threw in the insurance issues, which it certainly was listed in one of the position statements that it's important for healthcare teams to try to guide youth in how their insurance might change as they get closer to adulthood. So the program that I'm involved with at Sick Kids is called Good to Go. So the idea is that you're trying to frame it as a positive, that you're graduating from a pediatric center, not a negative that, oh my God, we're gonna miss you, you're gone. And the idea is that there are specific goals for youth to advocate for themselves, to maintain their health, and to effectively utilize the adult healthcare system. And I think the posters are put up around the hospital and are certainly for families, but I think it's also a good reminder for healthcare teams to actually think about this as well and to talk to their patients about it, because I think sometimes the healthcare providers can get focused on what they need to do and what organ they're looking at and what they're talking about, but that we need to think of the patient and family as a whole and guide them through to their future. So this just is the idea that transition versus transfer, and I think sometimes transition people think that the transition is the transfer, but the transition is the process, which is much longer in helping youth get ready for adult life. So not just being healthy adults and getting the right adult health provider, but having all of the skills necessary to lead an active and fulfilling adult life. Where transfer is just, that's the day that's your last visit, and then you're on to another healthcare provider. So what's all the fuss about? So there's certainly been lots of literature to suggest that teens may experience challenges in the adult healthcare system, which may lead to loss to follow-up, or at least a gap in their healthcare management, which certainly can be, whoops. Get back, hold on. Which can be very detrimental, particularly for the MPS population. Not following up on treatment plans or follow-up plans, which could lead to increased visits to the emergency room or hospitalizations or further complications. So there is good reason and certainly lots of literature about transition and the importance of transition and trying to do the best job that we can. So there are some differences between pediatric and adult healthcare, and I'm probably biased because of course I work in pediatrics, but just sort of that we try to kind of point that out to youth before they transition, that pediatric care tends to be family focused, so there is a lot of talking to your parents, and often that if you've been with a team for a long time, they know your parents very well and they end up doing all the talking to them. That it is definitely developmentally appropriate and that the parents have a lot of participation in that, and that there's a multidisciplinary team, at least at my center and usually at centers. In adulthood, it tends to be more patient focused, certainly adults, physicians allow support people to come in, but certainly it tends to be much more focused on the patient themselves. It's more autonomous and independent and requires a bit more of a consumer skills in order to get what you want as an adult patient. And that there tend to be fewer interdisciplinary resources at adult centers, at least in the ones that I'm connected with, and we can hopefully talk about if that works the same here. So from a youth perspective, how can parents help? I think certainly parents supporting teens to see their healthcare staff independently. I think that's sometimes hard for parents, and certainly parents are certainly welcome to have their own questions. I think what we try to do at our center is to have a visit that starts with the whole group, including the parents, so they can have their questions answered, and then a part of the session that's spent just with the teen so that they can have some private time with their healthcare provider. It also allows them to ask questions that they might not be comfortable or discussing with their parents present. I'll talk a little bit about the three-sentence health summary a bit later, but it's a way to help youth advocate for and present their information to their doctor, which it's a self-advocacy and how to communicate with healthcare providers that can be valuable. And then teach the teen how to manage their own healthcare needs. So giving teens opportunity to refill their medications or make their own appointments or figure out how they need to do these things, which I think as parents often we try to remove that quote unquote burden, but I think it's often to the detriment of youth who then it's overwhelming if they have to do everything at once. So if getting them set to do some of these things with supervision, I think is a very valuable tool to help them. So you can also help your teen understand the effect the health condition has on their present health and their future health, because I've found in my discussions with youth, when they understand their condition better, that it helps them follow and manage and understand why they need to do what they need to do to keep themselves healthy. Certainly teens are more of questioners as opposed to I'm going to do it because my parents tell me to do this. So I think having those discussions of making sure they understand why they need to do it can be very valuable. And trying not to be a helicopter parent, which I'm not sure I actually like that term, but the idea is certainly trying to let your child do what they need to do to explore, learn, and fail, which I think is often hard, but also a very valuable thing in normalizing their lives as normal individuals, and also helping them to advocate for themselves. So you can help them learn to ask key questions, like what is my main problem, which may be different, not necessarily your condition, but what is your main current concern? What do I need to do, and why is it important for me to do that? And there are a lot of websites with information on how to do those things. Just to go through a few of the resources that we have used at SickKids, and just to let you know, all of the resources are available at the website, and everything's web-based and certainly downloadable and usable. So if anything strikes your fancy while I go through the slides, certainly you can access them through the internet. So the group has put together what's called timelines, that then they say ready, set, go, and they give an idea of, just broke it down here, of certain things you do at certain ages as parents, what you teach your children at birth to 3, 4 to 7, in regards to self-care, general, social, self-care, education, and medical. And I was just going to highlight a bit of the medical, but some of the general things are things you would do from a social perspective. You take your kids to the park and play with other kids. You encourage them to do sports or things that they like. And these are things that you teach them to do as they grow, and you teach them things within managing their own health. That's important as well. So for instance, if I can read this, basically, keeping a record of your child's visits. This is when they're very young. Schedule regular visits. Apply for anything. Use play activities and books to talk to your child about their condition. From 4 to 7, they suggest ensuring that your child knows the name of their condition and teach them about symptoms. Ask the child life specialist, which I'm sure that hopefully people have access to those as well, to help your child learn about certain conditions and certain things, and to help promote a positive hospital experience. I think sometimes, in my experience, the hospital experience is very stressful for families and often sometimes for parents more than the child, and I think that the child then gets the parents' anxiety about the hospital visit. So if you can try to change that into a positive when they're younger, it's certainly easier as they go forward. And then some of these other things are make a list of questions and concerns with your child before the appointments. So it's helping them identify what they need to talk to the doctor about and giving them skills that they can use as they get older. For teens, again, getting the idea to talk to your healthcare team about birth control, drugs or alcohol, or things that would be something that the teen would want to talk about without their parents present. And then making sure that as they're older, they realize that they should be actively taking discussions with their healthcare team. The other thing that is valuable, and we have these both for patients and parents, are what's called readiness checklists. And I've seen different types of checklists available on the internet for transition. And the idea is that it gives you can go through these parent and children together and see kind of where you are at on this scale and where you need to work on. And you can do that we try to start at 12 or 13, and then it shows them how they should, maybe things they should do in between appointments to kind of learn a bit more about their condition and kind of get there. So just for an example, I can describe my chronic health condition to others. I know what my health future might bring. I do my own treatments as required. When I get sick, I know how to get the help that I need. And then some of these things are, no way, I'm thinking about it, or I'm there, I've got this one. And so it sort of cues both the family, the youth, and the healthcare team on what things that they should be focusing on to get the teen all the way to the I've got this by the time they're ready to transfer into adult care. All right, I'm going to speed up a little bit. The 3-sentence summary is what I spoke about before, and I think it's a way of sort of prioritizing how you summarize complex medical information, particularly if you go to a new specialist. And so you want to you have a long medical history, but you want to get there quickly before you lose their attention. And so the idea is to teach youth to do this in 3 sentences. So the idea is the first sentence is my age, diagnosis, and a very brief medical history. Second sentence is my treatment plan. And the third sentence is my question, concern to talk about during this visit. So you get to the punchline pretty quick, but you're able to give the very succinctly, the very detailed information that's required to get to the question. And I think that that's very helpful, just to have a framework for how to get to the meat of what you're discussing. The other thing that's valuable, and I will use this with patients in clinic to help them learn about their condition, we call it a My Health Passport, and it's a portable medical summary. So again, you can do this online, and it prints out like a little, kind of like the size of a credit card, and I have this fancy laminator so I can laminate it, and some kids can put it in their pocket, in their wallet. And again, you can't fit a ton of things on here, but you can fit in your name, your birth date, your diagnosis, any operations or allergies, or the things that are important, kind of our drug coverage, healthcare providers, emergency contacts, pharmacy numbers, things that might be valuable for youth to have in their wallet so that they can then, if their parent says, well, you need to reorder your medicine, well, I don't know the phone number, but they can pull it out and have the phone number. So it's a very useful, small thing to have to be able to help youth be able to do some of the things that get them where we want them to go. This is a larger one that's from the Scott Transition, which is a US-based program. And it's, I think, a 3-page kind of summary, which I thought was valuable for a different use than the portable medical summary, but kind of keeping track of things, particularly surgeries, things like that, where you might want to keep a prospective summary of things that are valuable to know. And I thought this laid it out very well in keeping all the organ systems organized. That it might be valuable to have as a tool to be able to utilize and provide to a new healthcare provider if you have to transition or transfer or move or whatever. So I thought that was something that was valuable. The other thing that SickKids has as well is what's called a My Education Passport, so similar to the My Health Passport, but a way to sort of summarize briefly neuropsychological data, which again, I'm sure if you've had a psychoeducational assessment, you can be like multiple pages. And this was a way to kind of summarize all of the sort of strengths, challenges, and make all of that portable that might be valuable for presenting to teachers. And they suggest this be done with a professional, such as a psychologist, teacher, or social worker that can help put in some of that information. But certainly it might be very valuable for certain kids that just can summarize kind of their strengths and weaknesses and help that if there's multiple teachers as well. Okay, the other thing that I think is important to point out that it's valuable to do lots of research in advance before youth transition to adulthood to see what is available in your community and about academic supports for in youth with chronic health conditions, if there's any specific employment programs, financial programs that would be grants or education scholarships, things like that, or supports both for adults with developmental disabilities or physical disabilities that might need sort of applying in advance. So we have them for my local community, but I didn't bring any of those links, but I'm sure that some of those similar programs exist in your own community, but might require advanced planning. So thinking about those things in advance before adulthood would be valuable. So there are challenges with transitions, and certainly there's a lot of groups working on kind of what doesn't work and what might work better. Some of these things can be the availability of adult providers, problem with the transfer of information between pediatric and adult services. Within the adult world, some lack of knowledge about rare conditions or treatable metabolic conditions specifically. And one of the other challenges certainly can be the problem with developing trust in a new adult team. So this probably doesn't project so well either, but there are some specific issues specifically related for adults with MPS. There's not very much literature. There's one paper I could find with a group of expert physicians. This is Dr. Mitchell's in Montreal and follows a lot of patients with MPS. And there are many other physicians on this paper talking about their experiences with patients with adult patients with MPS. And I think developing guidelines and getting more information, collecting information is going to be valuable. What I wanted to highlight was the idea of that there are many adult specialists that are involved with the care and treatment of MPS patients. All of these included here. And that can impact the complexity and the sort of need for a multidisciplinary team or multiple specialists certainly can play into the problems with the transitions and healthcare management of adults with MPS. So this, Dr. Mitchell and the group in this paper had suggested that optimal care of adults with MPS require adequate transition programs that get patients ready to transition to adulthood. clear and routine evaluations of clinical manifestations of those patients in adulthood. Someone who coordinates it, so a core coordinator who knows the treatment and knows the multi-system complications, that can manage the team of the appropriate specialists. They suggest maybe the development of a specific rare disease clinics, and particularly better training of adults, physicians kind of in medical school about rare disease, and particularly rare disease with treatments, and more studies on adult MPS patients that can help provide those guidelines and make sure that adults get the appropriate care that they need. So I found one paper specifically about MPS and transition from pediatrics to adult care. It was in Spanish, so I had to get a very nice woman at my institution to just translate the tables for me. But the paper, I wanted to mention it because certainly it's something very valuable with this, for this specific talk. And some of the barriers they highlight relate to the different person. So this one would be the patient. Certainly some of the barriers can be disease severity, lack of trust, and lack of support. Within the family, they point out the connection to the pediatric team and the sort of worry about being transitioned to an adult care team. I thought that this was interesting, the overprotective style. I think sometimes it is hard for families and parents who've done so much for their children to kind of let them go a little bit, but I think that that's certainly going to be valuable for the normalization and health and value of the sort of goal for the adults. There are some barriers as well that relate to the pediatrician, because I think sometimes they think they have a better, they know more about the condition, and it's hard for them to let patients go. The adult physicians might not have the coordination of the services required, and there might be some problems with emergency admissions and things like that. Okay, I got a couple slides about taking control as an adult. So I think one thing that's important is that we know that adults with chronic health conditions can suffer from depression, and certainly it's a slightly higher risk for adults who have a chronic health condition. And one of the methods of perceived control over your life is certainly protective against both psychological sort of stress of having a chronic condition. So I think the idea of taking control is very important, and I'm sure my fellow speakers will talk a little bit more about that. But this Global Genes website had a lot about transition and the idea of how to take control as an adult with a chronic condition. And they talk about a few questions to ask a new doctor about, how many patients have you treated with my condition? What hospital are you affiliated with? Will you work with other physicians to coordinate my care? Things that can put you in the driver's seat and ask some specific questions to make you feel more in control. And then they had a list of other things that I thought were interesting about connecting with others, developing an elevator pitch, honing a identity outside of a diagnosis, which certainly all the keynotes I saw yesterday and everyone who's puts their things, the talks that I've seen while I've been here certainly show that that's what you guys do. I put attending conferences because I certainly think that this is where you learn from each other and take control of your lives for sure. There are certainly therapists that specialize with chronic illness that may be helpful. I thought this was interesting, keeping a record of symptoms, triggers, and their levels of severity so that you have an ongoing active information about your healthcare, and keeping up to date with research, which is what we just have been learning the last few hours. All right, here is my list of resources. So again, there are many others that I didn't talk about, but certainly the one from my institution, the Good to Go. There's the National Healthcare Transition Center, which is US-based, which had the nice long sort of summary, which I think is valuable. And then Global Genes, which is what I was just talking about with some of that take control. I want to say thanks. I thought this was cute because it says, what is it exactly that bothers you about seeing a pediatrician? And I think it points out that, adults need to be treated as adults. It doesn't matter about your intellectual ability, your size, your whatever your complications are. We need to transition patients into adult care for their best health. I want to just thank, I'm a few minutes over, but I wanted to thank you for the opportunity to come to this meeting. It's been great. I'm honored because I was able to bring my 2 sons who have been in the Camp Courage, seeing the beauty and resilience of kids with MPS, and now they know what MPS means, so that's very wonderful. So thanks so much.